Thank you.
Thank you so much, Mr. Semakula. But again, when we talk about freedoms and all, well, we'll get the issue of the entertainment a little bit later. But let me come back to the Ministry of Health here. Dr. Mutumba, the conversation we're hearing from the Ministry of Health, the CSOs and the other development partners, even the young people, our focus seems to be enclosed within the schools or safe spaces. Is the ministry engaging those out of those particular safe spaces? Because they are teenagers and adolescents who are not going to school. Some are disabled. We want to understand the issue of inclusion. How are we, because we're designing all these policies in our programs, but are they inclusive at the end of the day to those with impairments and to those who are not in safe spaces like schools?
Yeah, so thank you. When you look at what the Ministry of Health is doing in terms of mandate, the ministry has developed standards, but also guidelines.
Dr. Mutumba, can we try as much as we can not to hide behind the word mandate? Because the moment you start to go technical and you hide behind the word mandate, you're not going to give me an answer.
Okay, I can probably
We are having a youthful conversation here.
It's simpler.
Please.
That, again, when you look at the guidelines that have been developed,
Better.
they cater, and I think I probably made a mistake to begin with mandate, but again, it's through the mandate that the guidelines are developed to ensure they include, they provide for inclusion of all these other vulnerable, disadvantaged groups. And the other thing I wanted to add in that regard is that the capacity building that's ongoing ensures that the health workers are oriented on the provision of services that are responsive to the diverse needs of these young people, including those who are, these days I'm told we don't use the word disabled, but those
special abilities.
Those who have special abilities or able differently, you know. Yeah, so when you look at what's happening, broadly, someone mentioned that why don't we have a special group of health workers at a certain facility who are oriented on providing adolescent health services. And the challenge here is that 60% of the population that gets to the facility also has the young people. So the focus is to ensure that every health worker, whether he's a dentist, is a nurse, a midwife, a doctor, lab tech, is oriented on the provision of these services. And that is inclusive and caters for the needs of the wide range of the different young people.
Now, you see, you've empowered the doctors and the nurses on the other side, on the receiving end. How do you empower the ones in the villages that they have the confidence to seek the services? Yeah.
So again, through the service delivery models, we have a number of activities or interventions, including targeted but integrated outreaches, again focusing on the young people. But also we have a number of focused discussions and dialogues with the young people to better understand their concerns and craft mechanisms of addressing these. So through the outreaches is when we really get out to interact and provide services to these other out-of-school young people that you mentioned. And yeah, those are some of the interventions. And we appreciate that different partners in different regions come in to support the Ministry of Health to undertake some of these targeted activities to reach out to the out-of-school young people in this regard. Thank you.
This brings me back to Madam Nachivuka Noah from SEHAD. Gender-based violence has greatly affected safe motherhood. If I may break it down, to be a safe mother, you need to be decided to be a mother. And at the same time, you need to be grounded to be that. But could it lead to an increase of the gender-based violence and abortion and pregnancy and complications of adolescents? Do we have shelters for the young mothers in case this happens where they can stay? And if we have these shelters, are they widely spread across the country to meet the need?
Well, thank you. So allow me to say that I've spent 10 years in the fields in Kampala. I mean in Uganda, different districts. And for the 10 years, I've not worked for 10 years, but I've spent 10 years in the field. I have never seen a government-owned shelter. I have, however, come across shelters that are owned by private individuals and organizations. And I'm very much aware that these shelters are now, I don't want to say the word protected, but they're under the leadership of the Ministry of Gender for various reasons. The biggest challenge has been that all these years, we have seen young people defiled, young people raped above 18, defiled below 18, and what we have struggled with has been integration into the communities as we seek for justice for them. The shelters where these people are taken, if you opt to get one, because they also have their rules, also have limitations on the time period within which they can allow the young people there. Usually 3 to 6 months. Now, between 3 to 6 months, if this person was defiled and never given medication to prevent the pregnancy, it ideally means that by 6 months they're pregnant. Not yet delivered, but have to go back to the community. I've also realized that there's no one or less or few people that then prepare the people, the young people defiled or raped, to go back to the communities. It's difficult to see who prepares the communities to receive the young people. So for us that go to the field, we then get to be faced by a challenge of stigmatizing, finger pointing, and in the end, what do we see? Young people in the hands of the traditional birth attendants or hands of, they call them grandmas, in the communities, trying to carry out what we call unsafe abortions. Whether safely, they might go through it, but I've seen them do what is very difficult. Some health workers will tell you they have seen sticks in their vaginas. Others will tell you they have seen them with the throat. That's a part of the throat. Very damaged because they take jig. Others will tell you that they have seen them struggling to live because they blended razor blade and took the razor blade. Why? Because no one prepared them, no one put them in a shelter, no one cared to have them. I have tried to, now those will end up in the health facilities, again to be a burden to the health system that is already struggling, either with cases that need post-abortion care or eventual death. So we have tried to interrogate police, and police will tell you, but some, not all, stations or posts, mostly stations, will have a station for men but cannot bring in women. Now, because they can't bring in women, sometimes you're defiled, you're not the victim. You're not the one who has committed the crime. You should ideally be a survivor that should be helped. They'll tell you they're not connected to anyone. If they went to Wakisa Ministries will have its own specific rules. If they went to Champisi shelter will have its own rules. So it becomes a challenging thing. So one of the things that we have done to ensure that there's some bit of gender justice is to sue the lovely government as they had. To try to tell them, yes, that as young people that get defiled, they should take them on as mandate. We have not sued anyone in this room. We have sued the representative of the government, who is the Attorney General, to make sure that we have government-owned shelters where young people that get defiled and raped can be put in that room until a time where the government can say if they got pregnant, they can actually be supported through with government-owned resources because we pay tax. And if they deliver, prepare them back to the communities such that the communities do not stigmatize them That's why we still sit here and discuss the high rates of teenage pregnancies and unsafe abortions. If you could allow me a minute, in this country, and I'm reading Ugandan statistics, we have 336 out of 100,000 live birth mothers that die. Out of those 336, 26% are out of unsafe abortions. If you ask me to calculate what the 26% of 336 is, I hope Mr. Semakula is not listening, because he told me, I will think that is 87 mothers dying. Now the 87 mothers does not discriminate whether they're young people or adults.
Or adults, yeah.
So still have a long way to go as a country.
Wow.
Thank you.
Given that we have someone from Ministry of Gender, I'm going to request the mic to go to Patience from Minister of Gender, Labor and Social Development to respond to the issue and give us a highlight on how we are holding up when it gets to shelters. Because if the biggest number of shelters are owned privately, then who regulates them? And how do we balance that boat? Patience from the Minister of Gender and Social Development. For purposes of archive, I request you come forward that cameras can capture this feedback. Let's clap for her, she's coming, because this is feedback we need. We don't want to go and we say, she said, they said, when we didn't have it on record. So Patience is from the Ministry of Gender, Labor and Social Development. We want to understand what is the government doing about the shelters, especially to the young mothers. Yeah.
Can I stand here?
Please, you can.
Yes, thank you so much. But first of all, I will ask my colleague Ruth to come on that question, and then I'll come on the question of integration of SRH.
Okay,
Yes,
let's have
thank
Ruth
you.
to come. This is good. We are having good engagement now. Shelters.
Thank you very much.
Yeah.
Good evening, everybody.
Good evening.
I'm happy to be here. On the issue of shelters, the Ministry of Gender, in collaboration with the IPs, one of them Action Aid and others, we've developed the guidelines of the shelters, but these shelters are all privately owned. So we just go in to guide, give the structure and the guidance and the guidelines on how they should be used and who should be in the shelter and how the services that are supposed to be in the shelter. But they are linked with the district local governments for any referral or anything that may need for consultation or for further collaboration with the communities.
Thank you.
I hope I'm through.
Thank you, Ruth. Before you leave that place, I see a commissioner from Uganda Police. That is Afande Maureen at Haide. Let's clap for Afande Maureen. The moment I see Afande Maureen engages the gender-based violence unit in police, and now that you're here, Afande, in her submission, Madam Nachibuka here said that police at times addresses issues not expeditiously as it needs to be done. We want to understand, is our police well equipped to attend to these issues as and when they arise with the urgency they need? If not, where are the challenges and how do we come through?
Thank you, Andrew. I think this is one of the biggest challenges to the Uganda Police Force when it comes to addressing issues to do with victims or survivors of gender-based violence. To begin with, when the victims come, they are gathered at the counter where you're going to find so many officers. Should I call it like a screening area? This is where the reporting of the case begins from. And so many of our officers are shooting questions to this victim. Tell us what happened. Why were you going? What's your issue? How would you like to help? How would you like us to help you? So the victims, of course, cannot open up because we do not have friendly spaces for them to open up, because we are also struggling with even a place where to sit and try to interview this survivor. And when it comes to resources in terms of means of transport, we are still struggling. You either have a vehicle, you don't have fuel, or you have little fuel, but you do not have the vehicle to go and rescue this kind of victim. But also, coupled with the resources, we have the issue with the victim themselves. There is a lot of pressure mounted on